to Wellness Wednesday. Our topic today is living with COPD and asthma, healthy lifestyle tips. I am Margot Seidner, CEO of Breathe California of the Bay Area, Golden Gate, and Central Coast. Our mission at Breathe California is, as the local clean air and healthy lungs leader, Breathe California fights lung disease in all its forms and works with its communities to promote lung health. So fighting COPD and asthma is very important to us. And we're so glad you could be with us today to learn and hopefully share this information. Let's see who's here with a poll. Our communications director, Brian Sawyer, will be putting out a poll. Here we go. So if you'll just check off the answers to that, then we'll share that in a moment. So that must be our students out there. So it's with only a few people here, it looks like the people who did come early are the younger ones. So good to have you with us. And was there another question, Brian?
Yep, here we go.
Okay. Do you have COPD or asthma? Are you a caregiver, a family member, a medical care provider, or a student? Please check that and then we'll share.
And we have over half sharing, so I'm going to go ahead and end the poll now so we can see.
Okay, so we have more people here with asthma, and we have students, family members, and the medical care providers. So thanks so much for sharing that. A bit more about our agency. Our agency is celebrating 110 years of service this year. And I am celebrating this year as my 40th being working with our agency, counting my time as a volunteer. We began as a local tuberculosis society on March 21st, 1911 in San Jose. And we have broadened our mission and changed our name a few times along the way. Our key roles have been establishing tobacco-free communities, including some of the very first programming in schools or for cessation for adults, and also the very first ordinances locally to protect people from secondhand smoke. Also achieving healthy air quality. We were among those advocating in the very beginning who got the Clean Air Act passed in 1970, and fighting lung diseases like COPD, asthma, and tuberculosis. Pardon me. Our current priorities, as you can imagine, are COVID-19, which is a respiratory disease, wildfires, which cause serious lung damage and are growing in their severity and frequency, and the vaping or e-cigarette epidemic among our youth. On the screen, you see a list of our core service areas: asthma services, clean air and environmental services, community education, equipment provision, and so on. We address these through the following: health education for all ages, patient support such as free respiratory therapy equipment, including CPAPs, lung health screening, including spirometry, home visits for education and for assessment of respiratory hazards in the home, and also of fall hazards for our seniors. Information and referral, which until the pandemic included 50 health fairs a year, tobacco use prevention and cessation programs for all ages, and advocacy, of course, promotion of advanced vehicles such as electric vehicles through our Silicon Valley Clean Air or Clean Cities Coalition, which we coordinate, and supportive research. The second half of our mission, if you remember that page, talks about working with our communities. And that's how we get all of our work accomplished, partnering with schools, senior centers, medical providers, and community organizations every day. Now, speaking of partners, we have two very special guests today. Pharmacist Ashley Lee from Alto Pharmacy and meditation specialist Ofosu Jones-Quartey from Balance. Ashley will share about chronic conditions that Alto Pharmacy can help treat and lifestyle interventions for COPD and asthma patients, including the correct use of inhalers and spacers. We all know that during these stressful times, it is important to take care of ourselves and maintain our general well-being. To that end, we're also looking forward to information about meditation and a meditation exercise led by Ofosu from Balance. So we will be entering questions as we go along. You can begin now and enter them anytime, but just know that we're going to be answering the questions at the end of the program. Now, I'd love to hand it over to Ashley Lee from Alto Pharmacy to share some lifestyle tips and advice for those with COPD and asthma.
All right. Can everyone hear me okay?
Yes.
Thanks, Margot. It's so great to hear, we have community organizations like Breathe available to help make a difference for the millions of people living with asthma and COPD, especially during these, difficult times. So I really appreciate that. And we just out of curiosity, before we begin, I'd love to know if you've heard of Alto Pharmacy before today. Let us know in the survey that is upcoming. Is everyone able to see the responses? Okay, split evenly, great. All right, so can everyone see my screen also? All right. So for those of you not familiar with Alto, we are a full service pharmacy founded in San Francisco, California, and actively expanding to several states across the country. We are committed to providing a different kind of pharmacy experience that's focused on you as a patient, with free same-day delivery, easy access to pharmacists, and hassle-free insurance and copay savings. I will talk a little bit more about our services later on in the presentation. And before we dive in, I'd like to quickly introduce myself. My name is Ashley. I am a clinical lead pharmacist at Alto's growth team. I appreciate the opportunity to partner up with Breathe California and speak in front of you today. So without further ado, I'd like to start off with some background information. I'm sorry, I'm having technical difficulties here. There you go. Some background information on COPD and asthma. So COPD, as short for chronic obstructive pulmonary disease, affects about 24 million people in the US. Most but not all people with COPD either smoke or used to smoke. And about 25% of COPD cases are due to other factors such as genetics or environmental exposure. As the name suggests, COPD is a chronic obstruction of the lungs, causing difficulty breathing. It's sometimes also called emphysema or chronic bronchitis. In emphysema, the walls of the air sacs in the lungs are destroyed, so they don't function properly the way they should. And in chronic bronchitis, the airway lining becomes swollen and inflamed with a lot of mucus production. So most people with COPD have a combination of both emphysema and chronic bronchitis. In terms of the disease progression, it is a progressive disease, meaning the symptoms may become worse over time if not controlled. And the symptoms can include shortness of breath, wheezing, chest tightness, and the nagging cough, as well as excess mucus production. And about 40% of people who have COPD actually also have asthma. Asthma is considered a risk factor for developing COPD. It's a chronic lung condition in which the airways are chronically inflamed, making them hypersensitive to certain everyday triggers like smoke, pollen, dust, exercise, cold weather, even stress. So symptoms of asthma are similar to COPD, like coughing, wheezing, and shortness of breath. Oops. So while both asthma and COPD are long-term conditions, the good news is that they are highly treatable. And when managed properly, symptoms can be relieved and you can improve your quality of life significantly. For COPD, quitting smoking is the most important first step that you can take to prevent this disease from progressing. And avoiding secondhand smoke is also very important. For asthma, the goal is to recognize your triggers and take precautions to avoid them. And to, again, control your symptoms by paying attention to your breathing and making sure your daily asthma medications are working effectively. Having said that, it's important to remember to always use the right type of inhaler to control your symptoms. During the course of your therapy, you may often be using more than one inhaler at a time on a regular basis. And in general, you'll always have a rescue inhaler that you use to control acute asthma symptoms or flare-ups, whereas maintenance inhalers are intended to be used daily to keep those flare-ups in check, so you won't need to use the rescue inhaler as often. All right. Oh, before we dive into that, a good rule of thumb to remember when thinking about maintenance inhalers and rescue inhalers is that if you are finding yourself needing a rescue inhaler more than twice a week, then your condition might not be as well controlled and you might want to consult your doctor and you may benefit from adding a maintenance inhaler at that point. And another important way to manage your COPD and asthma is to adopt the proper technique to use your inhalers. As obvious as it sounds, for a medication to work properly, the patient has to be using it effectively, right? So unfortunately, many COPD and asthma patients suffer unnecessarily from symptoms due to poor inhaler use. So a proper technique ensures that the medication is being delivered into your lungs the way they should. So now I'd like to take a few minutes to demonstrate two common types of inhalers. Obviously, the exact technique depends on the particular inhaler that you're using, but in general, they can be classified into two common types. A metered dose inhaler, or an MDI, such as your albuterol, or a dry powder inhaler, or DPI, such as your Advair discus or Flovent discus. So I'll go ahead and begin with a metered dose inhaler, which generally looks like an L shape. And you can use this type of inhaler with or without another device known as a spacer, which looks like this or something similar. It's essentially a tube that attaches directly to the inhaler, and it helps to coordinate breathing and holds the medication in place. So until it holds the medication in place until you can breathe it in to make sure you're getting the right dose into your lungs. So let's begin. So you wanna hold the inhaler, take off the cap, and then inspect the mouthpiece to ensure that it's clean before you obviously want, put your mouth on the inhaler. And then shake the inhaler for a few seconds. And then if you're using a spacer, attach the spacer to the inhaler in this step. So just like this. And then you want to take a deep breath and exhale all the way. And then hold the canister with your index finger and securely hold both the inhaler and the spacer. And you want to place your mouth into the mouthpiece. And as you press down on the inhaler, you want to breathe in slowly and deeply. Hold breath for about 5 to 10 seconds, or as long as you can hold your breath. And then remove the mouthpiece and exhale slowly. So let's take a puff. So that is one puff. And if you are using more than one puff per dose, you want to wait about 1 minute or so before you take your next puff. Okay. And then another type of inhaler is the dry powder inhaler, such as the discus. It looks like a flat disc, hence the name. And you do not need a spacer with the dry powder inhaler type. And make sure you wash your hands properly before each dose. And then with the discus, an important thing to remember is you always want to hold it horizontally during your dosing. Now we're going to expose the mouthpiece by pressing it back all the way until you hear a click. Now the mouthpiece is exposed. And then next you want to pull this lever for a second click. And when you hear the click, the dose is ready to be delivered. Now, same thing as earlier, you want to take a full deep breath in and out away from the inhaler before dosing. And then place your mouth into the mouthpiece. Inhale quickly and deeply for a full dose. And then hold your breath for about 10 seconds or as long as you can hold your breath. And then exhale away from the inhaler. And then we're gonna close the inhaler back up and you're all done with the dose. So let's try it out. Open it, click the lever, second click. And also remember, if your discus contains a steroid, such as Advair or Flovent, always make sure to rinse your mouth with water after each dose. I'm gonna close this back up. Okay. All right. Let's see here. So now we have a second survey coming up, and we want to hear from the audience. In your opinion, what is the most important for a pharmacy to have to meet your needs? Okay, let's see. A pharmacy that handles insurance coordination with you, of course. A pharmacy that helps find savings to get you the lowest price possible. A real pharmacist, always accessible and ready to help. And lastly, all your medication needs met without waiting in line. So I think that Alto Pharmacy has all of these needs today. Oops. There you go. As I briefly discussed earlier, we are a full service pharmacy that hand delivers medications directly to your door 7 days a week, even on the same day as your doctor writes the prescription, especially for urgent medications such as antibiotics or pain medications. We are in network with most major commercial and Medicare, Medicaid insurance plans and handle all of the hassles in dealing with the insurance companies, including automatically applying coupons whenever eligible, so to help you find the best price possible. Also, our pharmacist team is more accessible than what you would typically find at a retail pharmacy, either via phone, call, text message, email, on the website, or via the app. And this helps to kind of cater to everyone's on-the-go lifestyle these days. And the best part of all of this is that our services are completely free. As long as we receive prescriptions by 5 o'clock, we are able to deliver with our own courier in these zones as highlighted in green on the same day. And there is a caramel treat in every care package delivered. So how do you get started? Simply ask your doctor to send a new prescription to Alto Pharmacy. We are already in their electronic prescribing system. So your doctor can simply search our name in their database and should be able to find us. Or if you're currently using another pharmacy, you can request a transfer online or by calling or texting us. And then the rest of that, we'll handle the rest of the steps. And all you have to do is just pick a time and day for delivery, and we will be there. All right, that is it. And I will be handing it over to our meditation specialist, Ofosu. Let me stop sharing my screen.
Thank you so much for that super informative presentation, Ashley. And welcome and hello to all of our attendees. Good after. Oh, no, it's good morning for most of you. Yeah, I'm on the East Coast, so it's afternoon for me. Well, hello, everybody. My name is Ofosu Jones-Quartey. I am a meditation coach, and I am one of the voices on the Balance meditation app. I live in the Washington, D.C. metro area, and I am married with 4 little ones. Some are very little, some are not so little anymore. I started meditating about 20 years ago when, about 20 years ago when my wife was pregnant with our first child. And it really began as a way for me to connect more deeply with myself so that I could be a better dad. That was my initial motivation. And it's been a practice that has stuck with me all these years and turned into a part of my career, and has proven to be very beneficial in my life with managing my own anxieties and mental health issues, and in being able to be helpful to other people as well. Throughout the years, I have taught meditation to kids as young as 4 and adults of all ages in different places. I'm a teacher with the Insight Meditation Community of Washington. I've taught at places like Spirit Rock, IMS, Spirit Rock in Marin County, in the San Francisco in the Bay Area, IMS in Boston, and a few other wonderful places. And had the opportunity to travel, etc. So I am super happy though that I'm able to share the benefits of meditation with people all around the world now through the Balance app. It's been something that I know has been helpful to folks during the pandemic when people's mental health issues either came to the fore or spiked. And just being able to have a meditation mindfulness resource right in your pocket is something that has been super helpful to people, and so much so that we decided that we would offer a free year of Balance to folks who decided, to new members who subscribed for the rest of 2021. So what is Balance? Balance is a highly personalized meditation program that adapts to you specifically. So each day you answer questions about your meditation experience, what your goals are, what's challenging for you, and then pulling from an audio library with thousands of meditations and clips that I've recorded, Balance assembles a meditation that is just for you, completely personalized. And it's a really unique experience. And I haven't really seen anything else like it before. So, oh, pardon, there's a big siren going by. Let's send some good energy to whoever those sirens are for. All right. So regardless of if you've ever meditated before, or if you're completely new to it, or if you've been doing it for several years, Balance is designed to meet you at your level and then grow with you and adapt along with you. So it's the same way that you would be able to develop an ongoing relationship with a live coach. So there are hundreds of meditations on the Balance app right now. And we are adding more every month. I just finished a multi-day recording session to add some more really awesome meditations to the app. So I encourage you to check it out. And I would like to, if it's okay with all of you, to lead you through a quick live meditation right now. Is that cool? Yes? All right. So to do this practice, you can either have your eyes open or your eyes closed, whatever feels right for you. I typically will always close my eyes, so that's what I'm going to do. And you can sit or recline or stand in a posture that feels right for you. And in the posture that you take, you want to make sure that you're not too rigid or too um, loose. You want to be in a posture that allows you to be very comfortable, but also alert. So I invite you to just give yourself permission to settle into this moment. One of the ways that we can do that is by tuning in to the feeling of our feet, making contact with the surface beneath us. Taking a moment to just open our ears to the sounds that are happening around us, not judging them as good or bad, just allowing ourselves to relax and come into the present moment. Just allowing sounds to come and go. If you've ever carried heavy luggage through an airport or a heavy backpack through school, or even heavy groceries from the car into the house, when you finally set them down, your body and mind just kind of go, ah, that feeling of being unburdened. I invite you to give yourself the gift of unburdening yourself from the past and from what might happen in the future. Just allow yourself to be right here, right now, in this moment. You might gently direct your attention to the feeling of your body breathing, noticing the cool air as it enters your nose or mouth, and the warm air as it leaves your nose or mouth. Just noticing what it feels like to be breathing. I invite you now to gently take one hand and place it on your abdomen. Just let it rest there. You can notice whether your hand is cool or warm, and just experiencing that feeling of touch and contact. What can you notice? Perhaps you can notice a little rise and fall from your body breathing while your hand rests on the abdomen. And I invite you now to breathe deeply into your abdomen as much as is comfortable through your nose. So breathing in through your nose, down into your abdomen, so that you can feel your abdomen expand and feel your hands sort of rise up on your belly. And as you breathe out, you're going to breathe out through your mouth, and you're going to make your lips as if you were blowing a bubble or whistling. Just breathing in through the nose, expanding the abdomen, breathing out through the mouth, making a little circle with your lips, breathing out gently. You don't have to breathe too deep. You don't have to breathe with any intensity. Just doing this in a relaxing way. In through the nose, down into the abdomen, out through the mouth. Just noticing how it feels to do this. And as you breathe in, you might even invite a little smile to creep up on your face. Just giving your brain access to the natural response of happiness that comes when we smile, whether there's a reason to or not. Breathing in with a little smile down into the abdomen, breathing out through the mouth, relaxing the abdomen, relaxing your body. Let's do this for 2 or 3 more breaths. Finally, I invite you to think of one thing that you are grateful for in this moment. It's one person, place, or thing, perhaps, that is a source of gratitude for you, that you can refer back to throughout your day if you need a little pick-me-up. All right. We'll take one more nice breath, breathing in and breathing out. And when you're ready, you can gently open your eyes and come back. Please let me know how that was for you in the chat if you would like to do so. It'd be nice to hear. And as I mentioned in the beginning, well, first of all, thank you for practicing with me. I appreciate it. And as I mentioned in the beginning, there are many, many more practices, meditation practices on the Balance app that are good for helping you sleep, that are good for helping with motivation, helping with anxiety, all sorts of things. There are beautiful, innovative singles that involve sound and vibration. So please do check it out. For the rest of the year, we are giving new members a totally free 1-year membership, no strings attached whatsoever. So if you don't have the Balance app, it's available for iOS and Android. You just go sign up, and if you're a new user, you got it for free for 1 full year. And all you need to do is to redeem your full year is just go to the App Store and open it up. So I encourage you to please take advantage of that. Everybody needs a little bit of additional support these days for their mental health and well-being. We know that our mental health has a profound impact on our overall sense of well-being and or our overall health. So please, please do invest in your health in this way. And you know, we over at Balance, we want to help as many people as possible gain access to our app and to mental health resources as a way of supporting wellness across the globe. So with that said, I will pass it back to our panel. Thank you so much for practicing with me. Again, my name is Ofosu, and you can hang out with me more on Balance. Thank you.
Sorry, I thought you muted me. So thank you, Ofosu. That was so calming. I feel like I'm breathing better already. I should do more of this with my asthma. And I hope that those of you who have COPD recognize that he took you through some pursed lip breathing, which is very important with COPD. And that those of you with asthma probably recognize the belly breathing that we try to have you do. So these are very important techniques. And I would urge you all to take advantage of that free year. I know I'm going to, and my daughter, who really loves yoga, will also. So before the question and answer session, and I want to remind you that this is your last chance to put those questions in. Please do it now. Before that, I wanted to remind you that thanks to financial support from so many great partners, almost all of the services from Breathe California are free. For example, we have many partners who help us with our COPD and asthma programming. And some of those are the City of San Jose Senior Wellness Program, the El Camino Health, Peninsula Healthcare District, the City of Cupertino, the Sierra Foundation, and the National Heart, Lung, and Blood Institute, among others. So this is very important to us that we be able to provide our services free of charge, because Breathe California primarily serves communities that are disadvantaged and have health inequities. And for many reasons, lung disease is more prevalent in those communities. So I will give you our contact information at the end today, and I hope that you will come back to us if you need any kind of assistance, and that you will share this information from people you know might profit from it and be able to reach us. And you can always reach us on our website for lots of different information. So now let's go to those questions.
Well, so how can I tell that I am meditating correctly? We're answering questions now, right?
Yes.
Okay.
Go.
Just making sure. Well, meditation, I'd like to think of meditation as being something that is very, very simple. You are just doing your best to pay attention to what's happening in the present moment with respect to your own mind and body. And you're doing this with a kind attitude and without a sense of judgment towards yourself. So really, a lot of us, generally what I find is that people feel that meditation should entail some sort of total stillness of the mind and no distractions or anything like that. But our minds produce thoughts the same way that our bones produce our blood, you know, it's just what the mind does, you know. So if you have a lot of thoughts, you might just be a person that has an active mind, but that doesn't mean that you're not meditating correctly. So a simple practice is like the one we did today, where you just connect with your breathing for a few breaths, and inevitably the mind will wander off, and then you just gently bring it back. And that is probably the most simple, most universal type of meditation. Just noticing the feeling of your breathing. Doing the belly breathing and the pursed lip breathing is an excellent practice for anybody. And yeah, eventually your mind will wander off, and then you just notice, oh, my mind wandered off. Not a big deal. You just bring it back. So hopefully that's helpful.
Okay, next question seems to be for me. Can you use a spacer with a dry powder inhaler like Symbicort? So for Symbicort, yes, you can. Generally speaking, the different types of inhalers, we have the meter dose inhaler and a dry powder inhaler. In general, for dry powder inhalers, a spacer or a type of chamber is not necessary because it's breath coordinated. So as long as you're breathing fully, the medication should be delivered. However, for Symbicort, it is a dry powder inhaler. However, you can still use a spacer with it. So it's not a hard rule, but a spacer can be used with Symbicort. Great question.
Okay, for me, how can someone who has never smoked get COPD? Well, I think that in Ashley's presentation, she alluded to the fact that there is a genetic condition. Alpha-1 antitrypsin deficiency is one genetic condition that causes very serious COPD. And in younger people, many of the people who get COPD in their 50s, for instance, have alpha-1 deficiency. And so that's genetic, and it's, again, it's progressive. And so you might need a lot of support in trying to face that. The other thing is there are a lot of environmental exposures. You might be either in working in an industry that has a lot of vapors and chemicals that you're working around that you breathe in every day. That's another cause for COPD that does not have to be related to smoking. And it's very important, if you are in that kind of industry, that you use your respirator. One of the things we find is that respirators are cumbersome. We all know masks now, right? We all really hate just the little mask. So you can imagine if you have to wear a respirator that is this big thing that fits all on your face, and maybe even pumps in oxygen, or at least has an air filter system. So a lot of people take those off when they're working, and that's very serious. So I would encourage people to respect that respirator. If they give you one, it means you're supposed to use it. But there's also air pollution. We know that the level of air pollution in some parts of the world, and even here in California sometimes, can be very serious. So you don't want to be exposed continually to that. And we're working as hard as we can to clean up the environment so that we don't all have to worry about what we're breathing. But that is another significant thing.
It's like this next question is for me. What if I feel too nervous or antsy to meditate? Yeah, that is also a common question. For many of us, the idea of sitting still for an extended period of time just doesn't seem to fit with our personality style, or just who we are. So there are a few ways to approach this. Number one, if you are a person for whom movement is more natural, you can bring meditation into movement. So you could practice yoga and just being mindful of the movements that you're making, One great way to practice mindfulness or meditation is walking meditation. We have some movement practices on the Balance app as well. But walking meditation is you're just paying attention to the sensation of your feet making contact with the ground. So you might just say left foot, right foot, left foot, right foot, or one step, one step, one step, or this step, depending on how fast or slow you're walking. And it's the same thing. Inevitably, your mind will wander, and then you just gently bring it back to the next step. So perhaps moving meditation or moving mindfulness can be a gateway for you to enter that the practice. Also, if you're interested in trying to practice a more stationary or sitting or still a more still kind of meditation, then give yourself a short period of time to do it. Just say, I'm going to just sit and notice my breathing for 1 minute. Give yourself an extremely achievable goal. If 1 minute seems excruciating, say to yourself, I'm going to sit and try to notice my breathing for 10 seconds. And just see if I can just notice the next 2 breaths I take. And as you get more familiar with that, then you can extend it a little bit. So just try bringing mindfulness to movement. And also, if you want to practice a more still practice, keep it very short and very accessible, and see if that's helpful for you.
Okay, next question is for me. What can I do to help if I don't have my rescue inhaler during an asthma attack? That is a really good question. I'm sure, this happens, more often than we'd like. The most important thing that you want to remember to do when this happens is make sure to sit upright to keep your airways open. So avoid lying down or bending over when you're having an asthma attack, as this can make your symptoms worse. And then, as difficult as it might be, try to remain calm while you're having the attack, as if you're panicking, stressing over it, it can worsen your symptoms. So try to calm yourself down as much as possible. And while you're doing that, try to focus on steadying your breathing. So take steady, slow breaths, as hard as it may sound, to focus on your breathing and keep it steady, to keep the air, air flowing as much as you can, and try to move away from triggers. So if you have, obviously, for an asthma attack to happen, most likely, it could, you have asthma triggers present that typically triggers you. So you want to step away from that as much as and as far as possible. Again, common triggers being, exercising or irritants in the air, pollens, dander, dust, certain foods. So try to avoid and get away from those triggers as much as you can. And of course, call 911 if your symptoms are not improving.
And one other thing I found really helpful is to sip water. We usually have our campers do that if they are having a problem, because it thins down that mucus that a lot of asthmatics have, including me. That's why Brian's muting me. So.
Oh, there's a question
Oh,
for you,
here we
Margot.
go. I just saw. So could my child's asthma go away when she gets older? I would say it could seem to go away. When you have asthma, you have a condition that will always be there. You have hypersensitive airways, and they're going to be hypersensitive, but they can get much less so as a child ages. The other thing is your respiratory system gets bigger, so it takes a lot more to clog it up. So if you get the inflammation down and you practice all those good things we've been talking about today to manage asthma, you can go for many years with what seems like no asthma. You can go off medication. I myself have been off medication for some time and then had to go back on it. So it depends on what you run into trigger wise and how serious that is. But many children appear to outgrow it. I told my son, who's now having reactive airway disease again at 40, that he had a good long spell there where he was without asthma symptoms. So that's good. That's what we hope for.
All right, next one is for me. How long does it take to establish a meditation practice? Um, you know, it's really there's no right answer to this question. I think every time you come to meditation, that is your practice. So I think the goal should be to show up in whatever way is sustainable for you. So for some people so for me, um, I sit pretty much every day for anywhere between 15 and 30 minutes every day. Um, and sometimes shorter, sometimes longer. But that's doable for me. For some people, that might be very short. For some people, that might seem like a big commitment. So really, whatever's sustainable for you. If it's easy to do 5 minutes every day, then do that. And if you happen to miss a day, then that's really not a big deal. It's a matter of being able to practice in such a way that you can make it a part of your life, in perpetuity. Um, so there's no particular length of time that it would take to establish. When you're meditating, you're establishing your practice. So that's really what it is. So just bring yourself to it with a curious and kind of adventurous attitude. Like, I wonder what I'm going to notice or discover about myself today. And keep trying to bring that attitude. There will be times where your motivation waxes and wanes. It's just like anything else. And there are times where you might want to take a break, and there are times where breaks inevitably happen, and it feels tough to come back. But you in those moments, you talk to yourself the same way you would talk to a friend who was maybe in the same situation. And you would always give a friend the easiest and most friendly advice. Hey, it's not a big deal. You just come back to it, no problem. So same sort of thing. Just try to make it curious, adventurous, and sustainable. So I hope that is helpful. Ashley, I think you have the next question.
You're muted, Ashley.
Can you guys hear me now?
Yes.
Okay. Is an over-the-counter inhaler like Primatene Mist a good substitute for a prescription rescue inhaler? My answer is no, it is not. Primatene, it's based, its ingredient is epinephrine. It is, it is not a good substitute to what an albuterol inhaler would do in terms of opening up your airways to help you breathe better. So I would not say that it's a good substitute to an albuterol inhaler by any means.
And one thing we probably should point out is that if you have a heart arrhythmia condition, that would be very serious.
I mean, Primatene was pulled off the shelves for, for some time, and now I believe it's back in the market, but I do not recommend that as a substitute for albuterol.
Okay, there's another question that says, if I get COPD, will I have to use oxygen and a cannula? And no, that's not necessarily true. There are all levels of severity of COPD, and you can, although if you have emphysema as part of your COPD, you can't really undo that. Some of the parts of COPD you can undo. The inflammation you can get rid of, you can treat underlying infections if you have chronic bronchitis. And there's so many new kinds of treatments for COPD, including a new kind of valve that lets certain parts of your airways function and the other parts not. There are types of surgeries. So no, you do not have to fear that you will be on oxygen. But if you do not address the underlying issues, such as smoking, those are things that could loom in your future. So I wish we had more time. Thanks to everybody. This was really fun, and we hope to do more Wellness Wednesday presentations in the future. Here is our contact information that I wanted to give you for Breathe California. Please jot that down if you will. And as you sign off today, I would really, really beg you to do the evaluation. We have our funders depend on this input to see how we're doing, and we depend on being able to give it to them to keep serving you. So that would be a big help to us if you do the evaluation. And now I would like to say thank you to everyone, and goodbye, and breathe easy.
Take care. Thanks, everybody.